thank you very much for doing this. I've been following you on Twitter for 4 or 5 years now, except when I got my Twitter account suspended, then I lost and I had to go back and re-find it. So I just refound you and just refollowed you here, though. Um, so you are, I get you said you do interior design of the mouth or something like that. You're obviously a dentist with which actually cares about diet, which is, I don't want to sort of paint all dentists as not concerned about it, but it seems like not as many of them talk about it as much. Although it's obviously their teeth are the leading edge of what comes into our mouth usually or typically. But tell us a little bit about yourself, if you don't mind. And you are in Sydney, I guess, or where are you at?
Yeah, I'm based a little bit north of Sydney. But I've done a lot of work in the US. My book that came out there. And so look, my work has been based around the idea that we see teeth as being affected by a diet, but we really haven't really ascertained what that really means. And early in my practicing days, as a clinician, I found that there weren't a lot of good answers to the issues I see in people's mouths, tooth decay and even malocclusion, which is crooked teeth, which as it turns out is a dietary problem. But I wasn't taught that in dental school. So I was a little bit disillusioned with the career choice that I'd made as dentistry, because I didn't think that I could be a dentist for the rest of my life. And I actually took a bit of time off. And in that time in Europe, I was in a traveling hostel in Istanbul, Turkey, and I stumbled across a book named Nutrition and Physical Degeneration by a dentist that was written in the 30s. And I just didn't know anything about it, right? I'm looking at this black and white book, with all these pictures of traditional cultures all around the world. And, my initial, instinct was to discount it, was to think, this thing's obviously been scientifically, disproven. So I stuck it in my bag and kind of went on my way. But that nagging feeling stuck around. And a few years later, I think I brought it back out, and I realized that Weston A. Price was actually talking about something that I didn't understand. As a practitioner that was trained in the 21st century, I didn't understand what this dentist was talking about in the 1920s and 30s. So that was kind of the moment where I began to really kind of dig deeper into, firstly, what we understand about food and the mouth and jaw. And the big thing that I really followed is how the jaw is affected by our diet. And so this is what Price's hypothesis was, is that when you change away from traditional diets, our jaw structure and dental arch actually collapses. So that's why people have crooked teeth today, which we're told is normal, and we just treat with orthodontic braces. But actually, it's a development issue that relates to both nutrients and mechanical function of the mouth, which really needs to be directed through growth and development phases. You can actually prevent it if you get people on the right diets and you functionally correct their jaws. And this is a really fascinating area that I now kind of call functional dentistry, that the mouth really shows us what we should be eating and how it affects the rest of the body when we don't.
Yeah, so interestingly, you talk, obviously the Weston A. Price Foundation, they've impacted a lot of people in the sort of ancestral health community space. You mentioned the nutrition can impact jaw development. Most of what I think about that is just the consistency of the food, the mastication, rather than eating soft food versus food that you might have to chew more, might lead to a more robust mandible and maxillary development. But are there nutrients as well? Like, is there certain nutrients that are going to shape the way the jaw is formed? You talked about malocclusion being a nutritional problem. How does that lay together? Is it merely mechanical, or is there some sort of biology or nutrition that goes on that?
Yeah, so the data we have from kind of anthropological and animal studies, and even Corricini looked at kind of rural and non-rural populations. When you take them off these harder diets, we see this deterioration in the jaws in one generation, and so that's one kind of idea that is reasonably well understood in the kind of conventional sense that chewing does have a biomechanical feedback to the jaw that helps grow a dental arch that is related to the width of the maxilla and subsequently the mandible. But what Price was talking about is he was actually looking looking at nutrients. He did say physical chewing affected it, but he was more concerned with the physical nutrients. And this is what I kind of followed, through my book. I was like, hang on. So this guy is saying that he went to 12 cultures and he measured the food in those cultures that ate traditional foods for generations upon generations. And then the people that had moved off that food in one generation, he measured what was in the food, and then he measured the effects on the dental arches. So tooth decay jumping to 30%, which we know is a modern disease, related to what we eat. But then malocclusions too. So the arches just collapse. Before that, you have perfect 32 teeth arches. You look at these pictures on the internet, you see these amazing wide jaws with wisdom teeth that fit. Wisdom teeth is the same issue. So what I found was there was this disconnect between the literature of understanding what Price was talking about these nutrients, and he identified three. Well, actually, he identified two, and one was missing. And so he identified vitamin A and D. He said, well, in traditional cultures, they ate foods rich in vitamin A and D, and they had this other activated X nutrient that seems to be hanging around all the time that works in a trilogy. And this is vitamin A, vitamin D. And 70 years later, Chris Masterjohn, who's based in New York, Brooklyn, New York, found with the Weston A. Price Foundation, found all this Japanese and also Eastern European literature on vitamin K2, which is different to the K1, which is a phylloquinine. K2 is a menaquinine, and it actually activates proteins that carry calcium and work synergistically with vitamin D. We have all that laid out there now. And so what that tells us is that vitamin D, which we know is a skeletal director of minerals into the bony tissues, so the maxilla and mandible are the same. And we know that its partner nutrient vitamin A also relates to facial development. So we know midline deficiency is probably related to clefts and tongue ties when we have issues with vitamin A, which we have a big conversation to have in society that we need more vitamin A with our vitamin D. But then the activating nutrient K2, which carries all the activates the proteins that carries all the calcium and minerals into the bones and teeth. If you have vitamin D without K2, your body will literally calcify up. And so that's what's the studies that show that vitamin D isn't effective in improving bone density through osteoporosis. When they give subjects vitamin D and calcium, that's without its support nutrient K2 and A as well. But what happens is that you get this buildup, and the fastest way you can view it is the calculus buildup on your teeth behind that your dentist clears up behind your front lower teeth. And that shouldn't be there. That's calcified plaque, and that happens in the plaques of your coronary arteries. It happens, in your kidneys, in your prostate. We calcify up because of this mismanagement of minerals. So we can actually, talk about this pretty hard line physiologically from the nutrients we have. Vitamin D deficiency now we know is far deeper than just bones. Bones is just the subsurface. It's the immune system. It's the gut and the brain all have hundreds and hundreds and hundreds of receptors, the gut microbiome. And also too, it directs hormones. And so that we also know that the skeletal system is a hormone directed system that relies on the body to signal via hormones to absorb things, and also to move nutrients in the right way, as the thyroid and the parathyroid play a big role in managing these nutrients. So it all sticks together in this quite complex picture, but Price was saying it much simply in that you need these three nutrients and your body sorts it all out. He showed the pictures of these thousands of people with nice round heads and huge cheekbones and enormous palates with wisdom teeth with space behind them because the mandibles just grow and grow and grow. Well, that's a functional system that's grown more from biomechanical feedback, but it's also had the resources, which is the nutrients, to guide the minerals, to guide the hormones, to guide the push for the body to grow this system properly.
Okay, so most of us listening to this have already made it through childhood and adulthood, and our face is fully well formed. How does that? Can we change malocclusion with nutrition in adulthood without short of breaking someone's jaw, or does nutrition have a role in that to some degree? Can you modify it with improving your diet as an adult?
So changing your diet there are all the inputs we discussed. So there are ways that you can change the jaw slightly, not in the way you can change a childhood jaw. You can actually completely reverse a malocclusion with simple orthopedic expanders and nutrition and postural changes in a child. The same principles in an adult work, but not as well. So you can actually align, minor malocclusions, a misaligned tooth, but you'll also prevent, the big thing is this connects to the jaw system, which directs how we breathe, and how you breathe affects how you sleep. And we are currently in a pandemic of sleep apnea. And so sleep apnea is where people breathe incorrectly during the night. It relates to heart attacks. It relates to blood pressure issues. It relates to metabolic issues. It has one of the strongest scientific links to dementia and Alzheimer's disease. So when we don't breathe correctly at night, the brain doesn't clear properly. And so when we use our mouth and our respiratory system incorrectly, so that's mouth breathing, we put ourselves at huge risk of sleep apnea, or even its little sister, which is upper airway resistance syndrome, which is the teeth grinding and all of the other issues that relate to sleep disordered breathing. And so as an adult, even though we may not get the really physical changes, we are preventing a host of issues when we correct our oral posture, and that's tongue to the roof of the mouth, supporting the oropharyngeal airway. It's breathing through the nose through the night, and this helps both release nitric oxide into the lungs and through into the cardiovascular system, helping the brain to relax its lymphatic system, so the brain releases cerebrospinal fluid for like a dishwashing motion that clears all the clutter that builds up in the brain through the night. And so when we breathe correctly, this is actually like a nutrient through the body and balancing through the sleep cycles where the body clears itself out. If you don't do that as an adult, if you don't consider this, then you put yourself at huge risk of all these subsequent diseases.
Interesting, because you mentioned, vitamin D, when we think of the bones, rickets or something like that, by the time it's affected the bones, it's really, that's pretty far gone. It's, you think of all these intermediate things. The immune system is, I would say, much more, fluid with its ability to change compared to, our skeletal system. How much of a change or a difference or malocclusion is required to cause breathing problems like sleep apnea? Is it pretty significant, or is it actually pretty minimal?
Well, look, so what we know now is that every tooth holds airway space. So in the maxilla, so you lose a tooth and you lose, there's a square millimeter measurement for volume in the airway. Because if you think of the roof of the mouth as as the platform for the teeth, well, it's also the floor of the nasal sinus. So if you look at a CBC scan or even an orthopanoramic radiograph, you'll see that the teeth sit in this bone, but then right above it is the nasal sinuses. And you see the relationship between the development of this dental arch to the volume of the sinuses. And so in children, we see that, when you have primate spacing, which is the gap between front teeth, you actually get the clearance of the nasal apiture at the back of the nose. And so this width, which is roughly, 2 to 3 mil. So when you lose this width of 2 to 3 mil, you start to get this cramping of the nasal apiture. You start to get this lack of airway flow through the oropharyngeal area, which is the back of the throat. And then you kind of add things on like inflamed tonsils and adenoids, and then the airway really starts to shrink. So we're probably only talking, okay, so if we measure it, for instance, as, how common is wisdom teeth extractions now, which is 4 adult molar teeth that we have lost that our DNA tells us we need to support our airway. So that's, a total, it's getting up to kind of 10 mil of just, sagittal and transverse space. And so this is all airway space that is, affects the musculature, affects the posture, and then becomes your physical architecture that the brain has to breathe through. So wisdom teeth, have a significant loss of volume. And then if we start to do things like, in orthodontic treatment, they often take 4 premolars out. So you're talking about another significant hit to the airway volume there it contracts the maxilla and mandible, and it creates huge challenges for the neurological system to breathe properly. So, we're only talking about, well, firstly, when we have tooth loss, we're talking about a very significant amount of jaw space. When you compare an anthropological skull, you see how wide and flat and U-shaped the palate is. Today, you see, the kind of at its most extreme level is the V-shaped high narrow palate, where you kind of put your finger up there, you can barely find the roof of your mouth because it's so narrow. And this is exactly what's affecting the nasal sinuses. And so even if teeth fit, sometimes you have this narrow maxilla, which really challenges the person to breathe through the nose. And then a lot of people also have the retrognathic mandible, which is the mandible that sits back. And you notice this in kids a lot. And you also notice in adults as well, where the lower jaw sits back, and if you look at them on side profile, you wonder how they breathe. And if you get a cone beam scan of them, you see that the airway is literally kind of paper thin because the mandible collapses. And this is what happens during sleep, which tells the brain to pull the jaw forward and grind the teeth to help stimulate the airway so the body can breathe during sleep. So there is a measurable effect, and it's significant. Some people have the effects even when they have a full dentition, because we don't use the system properly. Some have lost a significant amount of airway space with tooth loss and so forth. If listeners have had, either tooth loss or they had orthodontic treatment, their own history will kind of tell them, geez, maybe I'm at risk of this. Then you really should get an assessment with a scan to see if you're at risk, especially if you're having kind of the sleep issues, the digestive issues that you can't really explain. This is where I find that people are kind of, falling through the cracks in our healthcare system, because we aren't considering how craniofacial form affects many, many different systems. And that, we really should be considering our history and then both our presentation as an adult now and how to correct this going forward.
What percent of the, you mentioned that, my wisdom teeth never came in. I'm sure my jaw was small and it was designed to be. I don't know about yours, but what percentage of the population now is not have a fully developed jaw? And are there places where they still have what you would consider normal human dental anatomy?
Well, I mean, if you look at the rates of orthodontia now, which have skyrocketed, you think about how many kids that you knew growing up, that had braces, and then you might think if you have kids, when they were younger, how many, when I was growing up, there was 1 or 2 in the class. Now it's like 80% of the class has braces if they can afford it. We're talking, how many people grow 32 human wisdom teeth? It's getting to the 15%, 10%. And some people don't grow them. I didn't grow my lower wisdom tooth, and that's actually due to a space constriction on the tooth bud that should form when it's roughly 12 to 13. So kids are being then they're born at roughly 20% without wisdom teeth because there's no space in the jaw for the tooth bud to form. But we're looking at upwards of 85% of the population that are affected by this, that don't have an arch that fits the whole human dentition. And then even those that do still can have airway issues because we don't strengthen the tongue properly and understand that breathing and the disconnection from breastfeeding, or sometimes the roof of the mouth can still be a bit narrow even though the teeth are fitting, and that this affects the airway, and that over time it turns to mouth breathing at night, which turns to benign snoring, which turns to obstructive sleep apnea, which turns to Alzheimer's and cardiovascular events, because we don't consider this airway to be the precious thing that it is. It helps us breathe 20,000 times a day. So there's kind of many signs. We mentioned before that what can adults do? You can actually expand the adult palate. So there's a suture that runs up the roof of the mouth that can, with physical stimulation, you can actually slowly expand it. It takes years in adults, but you can grow the palate, and you can also surgically grow the palate. They can put implants and kind of bust the suture and give you 6 mil in a matter of weeks, which is pretty severe. You have a gap of the front teeth, but this can be corrected in adults. It's expensive and annoying for most, but the other side of it is you need to functionally learn to breathe again and to strengthen the tongue muscles to support the neck area and the oropharyngeal airway that helps us keep patent during sleep, which obesity is a big risk factor for sleep apnea. If you look at the neck area, it's the lack of tone and the weight that kind of presses on the airway that causes the vibration through the airway, which is snoring. So there's many contributors to it, but we really the lack of understanding of how teeth and the jaw connects to the rest of the body, through food is fundamental to understanding many of the issues people suffer today.
Yeah, I'm just gonna entertain somebody typed a question here, and I have no idea what this is. There's something called mewing, MEWING. Are you familiar with that, or you know what that means, or there's a question
Yes.
about its role?
Yeah, so mewing is named after, there's actually an oral surgeon in London, John Mew, who's quite old now, who's been talking about this for a long time. He's been lobbying and he's quite a controversial figure in London, but he's actually, his son, Mike Mew, trained as an orthodontist, and he's quite adored on the internet if you look it up on YouTube for this concept of mewing. And what he does is he teaches people how to press the tongue to the roof of the mouth. And this is what he does in his clinic. I've visited his clinic in Putney, London. And he helps to grow the jaw through postural principles instead of just dragging the teeth with orthodontic braces. His idea is that orthodontics, especially extraction orthodontics, which is quite prevalent in the NHS system in the UK, does damage to people. And he posts pictures of faces, how these faces collapse when we don't, even though you have straight teeth, you don't actually consider the craniofacial structure. And so mewing is this trend on the internet. It's quite popular that you have a lot of kind of teenage boys wanting to get the angled cheekbones and the angled corners of the jaw through correcting the posture of their tongue. And that's what it does. If you correct the posture of your tongue, all of the internal muscles that are directed by the hypoglossal nerve actually help strengthen the airway, and then the muscles and the facial muscles, which you shouldn't be using during normal posture, actually then kind of that they sling much better around the bones, which give you that nice bone structure. And you can actually get a bit of development in the bone, which especially in teenage boys, but this has been shown on the internet through adults as well, that when you train these muscles, you tone your face. And so that's this idea of what mewing is. It is it's an arm now, so it's called myofunctional orofacial myofunctional therapy that you can go to dental offices or sometimes general practitioners that have these people that teach you to use the tongue properly and understand the principles between tongue posture, breathing, and how it affects the jaw.
Yeah, you mentioned mouth. I've seen a lot of people taping their mouths shut to sleep and so on and so forth. Is that something that does anything effectively? Is that just cosmetic, or is there something to that?
It's definitely not cosmetic. It's not an attractive look to tape your mouth, but the idea behind it is that you're sealing the oral cavity to make sure that you're breathing through the nose. So this is the most basic thing you can do to make sure that you're nasal breathing. And so when you nasal breathe, you get all this access to the nasopharyngeal immune system. You get all the nitric oxide that's stored in the nose, and it's all humidified, runs through this very tight system that we're designed to use to deliver air to the lungs. When you breathe through the mouth, you don't get this. You get dry, unfiltered, non-nitric oxide enriched air that doesn't help the respiratory system infuse the brain with oxygen. So if you sleep for 8 hours with your mouth taped, breathing through the nose, you're going to feel markedly different because your respiratory system has been delivering oxygen more effectively to the brain. And actually what it's doing, it's actually helping the rise of carbon dioxide. So respiration, is a cycle. And what happens if you have the rise of carbon dioxide that helps dump oxygen off the blood cells into the cells. So when you don't get this rise of carbon dioxide, you don't get the dumping of oxygen. There is no lack of oxygen. It's actually, if you breathe incorrectly, your respiratory system isn't converting or isn't transporting the oxygen into the cells because of the lack of carbon dioxide. So slow nasal breathing using the diaphragm during sleep helps to have the natural rise of carbon dioxide and then the delivery of oxygen. If you look at the respiratory graph, you see how this carbon dioxide rise is important. And there's techniques called Buteyko breathing, which use these principles of mouth taping. There's a book written recently called Breathe, James Nestor, that's really popular. Has popularized this idea of mouth taping. But yeah, if you think that you breathe through the nose, the mouth, which most people do, I see it in many patients, then taping the mouth is the simplest way to redirect to nasal breathing. And, I do it. You feel markedly different in the morning because you've actually been receiving proper oxygenated blood to the brain. And it also helps you go through the correct stages of non-REM and REM sleep, which you have to go through 5. So if your brain is struggling to breathe, you don't go through the correct stages of sleep. You can get stuck in deep sleep, or you can be stuck in light sleep, where you wake up a lot through the night. So that's not ideal.
So as far as the sort of the practice of, I guess, holistic dentistry, which is, I guess, something that I guess you practice, what does that look like, for, like when I go to the dentist, they clean your teeth, he pokes his head in there, looks and says everything looks good and sends you on your way. What does a typical evaluation for you look like, and how do you, what kind of tools do you play with to try to get people better if there's problems?
Yeah, there's been kind of a movement around, what we call holistic biological dentistry, since probably the 80s, dentists kind of, moving away from what they were taught in school, metals and amalgams, they do contain mercury, and there's other chemicals like fluoride and so forth that there's an argument potentially against. So this idea of a term I coined called functional dentistry, that puts all of the principles of root cause medicine into a dental evaluation. So the main thing that we do, and that I'm teaching dentists to do, is to bring in the idea of root cause. So when you have a tooth decayed, for instance, so let's just talk about the most common presentation, which is one tooth that is quite rotten in the mouth. If you think about that from the point of view of what we've traditionally seen as a plaque buildup on the tooth, it doesn't make a lot of sense that you have one tooth out of 30 teeth in the mouth that is rotten to its core. It tells us there's a systemic issue there. So with functional dentistry, what we're going to try and do is find out what are the systemic issues that are contributing to the diseases we see in the mouth. Gum disease, for example, is the loss of gum tissue due to an autoimmune reaction. What happens is the bone levels actually erode as well, and it always sits alongside autoimmune issues. So when we're treating gum disease in the mouth, we're dealing with a system that is the gut, and autoimmune systems diseases are known to be linked to intestinal permeability, so leaky gut. So if we see gum disease, we really need to be thinking leaky gut, and how can we assess their risk factors, systemic measurements of CRP factors or other indications of bodily inflammation or intestinal permeability, and can we connect them to a practitioner that will address this? Can we give them some simple dietary, sleep, and gut-related factors that will help remedy the underlying situation, so that when we treat their gums through methods of, we'll use, traditional scaling methods, but we'll also use things like lasers and, certain topical, sometimes we use antibacterials depending, but we're thinking about the whole system. For example, the oral microbiome. Everyone talks about the gut microbiome, but the oral microbiome is the most accessible, and that's what dentists play with. So we should be thinking of this biological community as being a conduit for the gut microbiome, which we know now connects to so many chronic issues. And so if we do a simple, understanding of a patient's full health history, if we connect to their other practitioners, we're starting to see that this is a much more interconnected system, and that dental disease really needs to be treated with and alongside other issues instead of just being fixed. So instead of just fixing the mechanical issues in the mouth. And then the last thing is to biologically restore lost tooth structures. So when we're dealing with lost tooth structure, instead of putting something in that will challenge the body, like potentially a metal or a mercury-based filling, then we're going to put something in ceramic that's biologically sound, and that's going to to not interfere or present a challenge for the patient's mouth. And then so with all these principles, alongside everything else we were talking about with breathing and sleep and everything, we really are trying to give them a complete picture of their body, which is, absolutely connected to what they see in the mouth.
Yeah, I see, a little bit of a kind of a chicken and egg dilemma here. A lot of people have, I think maybe apnea related issues secondary to perhaps obesity and some of these things. And some people feel that the malocclusion could lead to problems with cortisol, and then that driving the insulin resistance and the obesity. Do you find that it goes both ways? That if you fix the breathing, that these things can sometimes improve?
Well, it's related. I mean, if you kind of zoom out, because that's a good kind of way to look at it, because we need to think about, what's really driving one of these, these conditions. But if you look at, from a broader perspective, obesity really kind of only popped up in the 80s, right? So, but malocclusion, was hanging around, a good 50 to 100 years before that. So when the population, what happens is that when we go off these traditional foods and habits as well, proper sleep and breathing techniques, we find the jaw deteriorates. This is what Price was observing in the 30s. So the warning signs were there. Jaws are deteriorating. What we did was we found out in the 60s and 70s how to orthodontically correct this to mask it. So we could make teeth look straight without fixing the craniofacial structure underneath. Now, the craniofacial structure is connected to the airways. It presents all these problems for poor sleep, poor breathing. Then we add in the hyper-industrialized diet through the 70s and 80s, the sugars and the refined carbohydrates that we just absolutely flood ourselves with now. All of a sudden we're obese because the our system is chronically inflamed. It's not sleeping well because we're not breathing well. I think obesity comes, we build the risk factors for obesity through improper jaw development. We see this in kids that they're just not as healthy. They have the endocrine issues to start with, the digestive problems. We don't breastfeed as much, which we know links to the insulin genes that present risk for obesity later in life. I think these problems start in the jaw, and this is why dental diagnosis and integration into the healthcare system is so important, is that we really start with the jaw and we build the principles into. We lack that. That's when things start to happen. You get obesity, you get endocrine issues. You look at sleep. There's 1 billion people on the planet with sleep apnea. There's 1 billion people on the planet with vitamin D deficiency. Hypothyroidism. Is this is arising because we consume an element that interferes with iodine, which we put in our mouth to harden teeth. But iodine is intricately connected to thyroxine, and then does this interfering affect the growth of the teeth, which does, it slows down the exfoliation of kids' teeth, and it's all interconnected. But I do think the dental signs come first, and then in the generations after, you get this increased risk factor for metabolic issues, type 2 diabetes, heart issues, like it all flows on from there.
Yeah, you alluded to some of the modern dietary problems. Is sugar causing problem with our teeth? Is that fair to say? I mean, I think to my view, it's a fairly straightforward thing, but there's people that kind of go back and forth on that. What is your thought on sugar, refined carbohydrates? I mean, or I guess more importantly, what do you think is causing actual dental problems outside of these facial development things? But I mean, actually, caries and gum disease and so on and so forth.
Yeah, so sugar's a good example. It's like the dental industry was kind of cotton on early to the problems of sugar, right? And so, we see now that sugar, it's quite, common to be talking about the metabolic issues of sugar. Well, when I was studying, 10, 15 years ago, that wasn't really discussed. We weren't talking about sugar as a metabolic driver for type 2 diabetes, even though it's blatantly obvious. But the dental industry was talking about how sugar seems to relate to tooth decay, and there's hard evidence of dose-related exposures to simple carbohydrates through sugars, and also recently refined carbohydrates in flour as well. And we know now, so since 2008 with the oral microbiome, we know that there's changes in the in the bacterial community that drive decay. Now, previously we thought this was an infection-related model where it was these bacteria pop up, Streptococcus mutans, due to the presence of simple carbohydrates, and that's true. But if we start to unpack it and peel back the layers, it's a bit more complex than that. The strep mutants live there in health, and what happens is that when you feed them a simple carbohydrate-based dietary habits, then what happens is that they start to overgrow. But what the real issue is that you're losing the bacteria and the diversity of the oral microbiome community that is inherent to keeping balance, because refined carbohydrates themselves won't always decay teeth. It's whether there is a defense system there, both in the bacterial community, which we know through anthropological studies was more diverse in hunter-gatherer communities, in communities that are connected to traditional diets, connected to nature. They have more diverse oral and gut microbiomes. And so what happens there is that you lose the microbial signals that then becomes the problem of the bacteria burrowing into the teeth. But we also we don't appreciate the internal and defense system inside the teeth. So inside every tooth is an odontoblast, which is a part of the osteoimmune system. And the osteoimmune system comes from your bone marrow. So it's signaled with vitamin D. And the body sends these cells there to act like SWAT cells or bodyguards, or kind of bouncers at the nightclub at the junction of the pulp, which is the blood supply inside the tooth, and the dentin. And what it does is it sends signals up the dentin tubules, which are like there's fluid running up and down the dentin. And what they do is they send signals and immune factors, including K2 related proteins, that actually can disinfect, can stop bad bacteria in their tracks. So you can actually stop it before it even happens, or it can remineralize the tooth structure. If you get a little bit of a demineralization, which is always happening with teeth, you get this directed from the immune system, which is vitamin D, fat soluble vitamin related immune reaction inside the tooth. So that's why people in traditional society, they never brush their teeth. They had this, Price noted there was green sludge all over, many of the populations of traditional societies he saw. There was never any decay. It's because their inner immune system is working properly, and it's just a biological system. That's why you don't see decay in any biological system except for modern human society and zoo animals. It's because we don't eat the right foods. We don't feed the immune system, which runs off sunlight. It runs off fatty foods, cholesterol-based foods that is converted into the hormones that direct bone growth, tooth immunity, and remineralization of the bony structures in both the mouth and the skeletal system. So that's one thing we forget, is that vitamin D deficiency is a huge risk factor for tooth decay and also gum disease. So when we don't reinforce the immune system with vitamin D and its support nutrients, then we get these presentations of bleeding gums, which is just inflammation, which vitamin D directly downregulates, tells you not to be as inflamed to everyday things. And then it directs the remineralization, the direction of cortical bone in the jawbone. So when you don't have enough vitamin D, you get inflamed gums, you get inflamed digestive system, your gums slough away because you don't have replenishment of the collagen matrix. Then you get the bone running away, just like osteoporosis in adulthood. So, I mean, this mechanism of vitamin D deficiency, which is kind of one mechanism, but goes back to Price's hypothesis, really is the big kind of canary in the coal mine, and also the elephant in the room for the dental industry. Why haven't we been talking about vitamin D deficiency?
Yeah, it's interesting. And I'm just, so the question is begged to be answered. Why aren't we talking about this? So I mean, if you were to design a diet that would provide what you think what the mouth needs or the teeth need, what would that look like? What does that diet look like to you?
Yeah, well, look, when I wrote my book, which is kind of 2015, and it came out in 2018, but I was putting it all together. There's this, we've got this kind of delicacy around dietary recommendations being based around vegetables and fruits being healthy. I wrote in the book, that, hey, hang on, you really need to eat these animal-based foods, which are, organ meats, broths, fatty meats. Don't be scared of butter. Don't be scared of dairy. Don't be scared of, fish and all this. These foods actually replenish the saturated fat, which helps carry vitamin D into your body. You need all this cholesterol. You need all these egg yolks. It wasn't very kosher at the time to talk about, kind of animal-based diets. So I didn't write it into the book in that sense, but it was an animal-based food program. It's a 40-day food program to help integrate organ meats and broths into your everyday life so that you're replenishing these systems. But I didn't go to the length of saying, hey, let's eat animal-based. But, since then, communities like yours and, people on socials have really kind of jumped on the idea. I think carnivore probably goes a little bit too far, but we have to be animal based. And I think that if we look at nutrition, animal foods as the nourishment and the core necessities for our bodies to have these nourishing animal foods that deliver fat soluble vitamins, sunlight, the highest form of energy, then we are completely mitigating any of the issues that can run from deficiency and that flow on, like the obesity, like the endocrine issues, like the digestive problems. So if people just flip that idea and thought about how they were getting high quality animal foods, consistently into their diet, and not kind of thinking of this idea of being plant-based, and that would solve a lot of the issues. And, I see this in patients, that the ones that are, removing animal-based foods, they are having more severe dental issues. And so it's a deficiency problem. I think we need to flip that conversation soon because, people are still feeling that the meat is bad and that the fat is bad, but it's what delivers the critical nutrients to your teeth, for their immune system, and to the skeletal system to reinforce itself.
I was going to ask you, I've seen a number of reports on people with plant-based diets having a number of issues with dental problems. So you mentioned that, animal products, whether you eat it in entirety or not, seem to be beneficial. What foods are just absolutely disasters for the teeth? I mean, soft drinks and stuff like that. But what are the things that you're going to tell everybody just don't bother consuming these things?
Yeah, so you want to be careful with things like fruit juices. Fruit juices really, it delivers a high concentrated, simple carbohydrate dose of fructose, especially to the liver as well. So we really need to cut down that fructose. I don't want to be too scaremongering on this. Like you've got the kind of the grains that delivers simple carbohydrates and the anti-nutrients. Vegetable oils are a big one. You have to get rid of vegetable oils, which you refine kind of canolas and cotton seeds, and there's a bunch of them in the American food supply. When I was just shocked when you pick up a package in America, how many different types of vegetable oils, refined seed oils you get in these foods is amazing. But you need to strip them out because they interfere with how the liver deals with fat soluble vitamins, and how they work their way into your lipid structure and your membranes of your cells. You need to get this out. You need to connect back to saturated fats that create that stability and the chemical reliability that animal foods provide. Fruit juices, I don't. So I've got 3 kids under 3. I don't give them fruit, and I'm not saying everyone needs to do that. Everyone gets kind of a bit funny about that. But the modern fruit we have is way sweeter than any kind of fruit you find in the wild. We've got a mulberry tree in our yard, and it's like this little purple grape-like fruit. And I was eating one the other day with my daughter, and it was like a really tart taste, like quite shockingly tart. We don't eat much fruit, but it kind of reminded me, how sweet are these. We've grown these fruits agriculturally, and people think that fruits come with all the vitamin nutrients we need, but there's really nothing in fruit that you can't get from an animal-based diet or vegetable-based that are a bit less sugar-based. So I kind of obviously people don't have to cut fruit out completely, but more so just kind of retwigging our idea of, fruit being the most healthy thing to eat, in that, if people have metabolic issues, if you have tooth decay, you probably have to be a bit careful with it. You really shouldn't have fruit juices or any kind of juicing, for that matter of fact, because it provides simple carbohydrates to those bacteria in the mouth. And we have to get back to the fats and the tastes that move us away from sweet.
Yeah, fair enough. I think there's an advantage for that in a whole number of regards. What outside of dental decay, and I guess malocclusion, what are the big issues are people having trouble with, in the world that you see that relates to dentistry?
Yeah, so the big one I'm seeing is the huge rise in headaches, migraines, jaw issues. So team J problems, temporary mandibular dysfunction, which is just rife now. And so when we're talking about, Sean, all these imbalances in our bite, we have an adaptation of our jaw joint to to posture our head. And so you have all these postural issues, which relates to breathing and to the development of the jaw. So, and it starts at an early age, but then it goes on to, to adulthood. And we're also a population that sits chronically, sort of slouched forward, shoulders forward, head leaning forward. And these postural issues have a huge impact on the body. You can see it in the mouth that the jaws deform further when we lean forward, breathing through the mouth and putting pressure on the neck and cervical spine. These problems are much more severe or much more debilitating than we give them credit for. When people present with chronic migraines, this is a long-standing postural issue that relates to how they sleep, how they stand, how they move, how they work. And we just don't have a lot of good solutions out there because it's a big issue. You've got all these muscular problems. You've got, pinched nerves. You've got the TMD, which is an incredibly sensitive area that sometimes gets locked up. So people can't even open their mouth, an inch because their jaw is so locked up, or they've got, unilateral pain through the jaw that clicks all the time. This is the flow on of not having proper skeletal development, not having the appreciation of how to support the jaws during posture with the tongue instead of the big chewing muscles. So we use the muscles that clench during sleep far too much instead of the tongue muscles, which are the postural airway muscles. And this flows down through the spine. We don't use the central spinal muscles to support the spine anymore because we use our accessory muscles and we just slouch forward. All of this relates to oral posture. You can kind of correct it as you go down the spine by starting with oral posture to the hips, delivery of kids, because the hip and the pelvis aren't supported properly. So we have delivery issues that then relate to craniofacial issues in the kids' development of their jaw. So we start them off badly, and this all relates to movement and how we support our biological system.
Are you seeing? I don't know if you see a lot of kids in your practice, but are you seeing these occlusions become? You mentioned more people with braces. Is this accelerating in your mind? And there's obviously this big push for plant-based diets. Is that contributing to the problem in your mind?
There's definitely a big push. We treat, our main focus is kids. There's obviously there's a big aspect of functional dentistry that is adults and correcting these things in adults too. But our focus is on kids because you can correct these things. And so you don't see many kids today that don't have these issues, and it can kind of show up with an open bite in an early age or a tongue tie in an early age that stops the connection of the tongue to the roof of the mouth, or you get the open bite due to thumb sucking or pacifier use early age. Then you get the lisp issues as they start to speak, and then you get the crowded kids' teeth, or once the adult teeth start to come in at 5 to 6, then you start to see these huge adult teeth, and all of a sudden we're thinking, holy moly, how much space do we need to fit these jaws? And even if the kids' teeth were spaced fine, the smile was right, which many parents probably think, you realize once you get a radiograph how much space this kid needs, and we need to start growing quickly, because between 6 and 12 is the critical stage where the kid will grow, where all the adult teeth are positioning to come in. And if you put growth signals in there, the jaw will just recorrect itself. So in our practice, we have many case studies where we see these crooked arches, and you can correct them if you get on top of it. It's a difficult thing to do. It's 2 years kind of functioning and using these orthopedic guards at night and learning how to use the tongue. It's a lot of persistence, but it works because you fix the signals that help grow the jaw. And if you get in there first before the adult dentition sets, you use all of the growth factors that are available during that 6 to 12 period. And you can even do it early. You can get in earlier, between 3 to 6. It's just a bit more difficult. You probably need pediatric specialists in that sense. We do some, but the focus, probably where we see this more large scale is where the pediatrics dentists are really kind of getting on board with early treatment. But so that to me is one of the most important aspects of our healthcare system we need to fix. We need to get in and fix these jaw issues in our kids because A, you can do it, but B, it relates to so many other problems through their life that we're just going to completely see dissolve if we can develop their jaws so their wisdom teeth fit. And so you do all this development during their growth and development between 6 and 12, then in adolescence, we keep the principles going, and then the wisdom teeth should have space to fit. They keep eating well, they keep chewing, they keep breathing through the nose. The wisdom teeth should develop then, and then you don't need to extract the wisdom teeth, but then you've got all this amazing airway space that supports their neck posture, their facial features, and their sleep all throughout their life.
Yeah, I'm just counting my own teeth. I think I got 16 on the bottom and 14 on the top. So I think I got two, and I don't know if that's more common or not. But let me ask you just the other end of the spectrum. So many adults, 50, 60 years of age, I mean, they're losing all kinds of teeth. I mean, they don't have these, bridges and partial bridges and dentures. How do we avoid that? I mean, my assumption is our teeth are supposed to last as long as we do. Is that a fair assumption? And why are we not seeing that? And how do we make sure our teeth last 90 years?
It's a very fair assumption because you look at the anthropological records and humans or any kind of biological creature don't lose their teeth. They do when we start eating the modern diet. So we need to get back to eating organ meats, broths, and all these traditional foods. So that's one thing we need to do. In adults, it will assimilate slowly. So if there's disease present, if there's bone loss, for instance, around a tooth that has become an infection in the gum, sometimes you can't reverse that. So there are some situations where you have to kind of cut our loss and say, look, we're going to lose this tooth. Is what it is. But the principles are that, so if you have an oral condition, you've got decay, which is a bit less prevalent in adults, but you still do get, I see a lot of adults with decay. But gum disease is the one, I see adults, in their mid to late 30s that are losing all their teeth, literally. Their teeth are and they're falling out. And so at that stage has gone too far. But if we can get to the earliest signs, so if we can pick up the metabolic issues, if we can pick up the thyroid issues, if we can pick up the sex hormone imbalances, PCOS is a hugely prevalent issue now with younger women. All these things drive inflammation that have warning signs in the mouth saying, hey, your gums are inflamed. It's actually related to a hormone imbalance that affects your bone density too. So if we can be more mindful as to what our mouth is trying to tell us, we can pick these things up and reverse them. You go get tested for your hormones, you go get your thyroid tested, you change your diet so that you're reducing your simple carbohydrates, and literally your gum tissues and bone tissues will solidify right where they are. They will strengthen because you've provided them the nutrients they need. And then, for the good thing is the dentistry is nailed how to restore teeth. We can put ceramic implants there now, which is biocompatible to replace teeth. Dentures are a great option for people that need to replace more teeth. Obviously, it's not your own teeth, but you still get the support of the jaw. You get the pressures through the jaw, and you get the chewing. And then bridges help as well, because sometimes when you lose a tooth, it's better to have kind of a tooth-borne replacement of the lost dental chewing surface area. So, and you just have to remember that dentistry, we're trying to restore something that is working in an environment with saliva and food, and it's 400 pounds of force being chomped down on. So it doesn't last forever. It doesn't always work. And dentists are very skilled at reconstructing this stuff, but sometimes there's issues, and sometimes, we kind of have to try a few different things. That's the perspective I'd take on it.
You mentioned something I never thought to ask why, but why is it that kids there tends to be a higher association with cavities in kids and not so much in adults? What is different about a child's mouth versus an adult's mouth? Are the kids just eating more junk food? Is it the candy kids are eating, or is there something else going on?
Well, I mean, it seems that the milk teeth are more sensitive to cavities, so they're less mineralized than the adult teeth. They're a bit different in the way the adult teeth stay under the gums. So there's adult teeth present in a newborn. So they're mineralizing for a long time. So adult teeth are stronger by definition, whereas the kids' teeth only get that kind of probably to 24 months to mineralize under the gums, whereas adult teeth spend a good 5 to 6 years, up to 7 to 8 years mineralizing the bones, tweaking it, ready to go out for the rest of your life. So that's why fundamentally kids' teeth are a bit more susceptible, because there's less minerals in them. But the other thing too is kids are more sensitive, we see a link between vitamin D deficiency during pregnancy flowing on to kids, and even enamel hyperplasia, which is kind of the brown developed enamel in kids that comes in when the teeth do. And it's because the teeth were sensitive to something. They had a fever, they had a nutrient deficiency, which we don't think of. Stress, I think, is a big factor as well. I think stress shows up in our teeth. It's like tree rings. You can kind of see discolorations in certain levels of teeth. You get central incisors, and the first molars are the first ones, because they mineralize first, and it's common to have issues then. All of these things contribute to how your body's putting minerals, because it's a very energy heavy process to be mineralizing, up to 20 to 25 teeth in the jaw at one time. So if your energy is going elsewhere, then your body's not going to spend time it needs to mineralize these things. And kids, really are. One thing is they bounce back quickly, but they are very susceptible to these things, and things like plant-based diet. So if you, as a mother about to conceive, if you had a plant-based diet, for 1 to 2 years, even in the past, that's a time when your body was deficient, and it's probably going to show up in your kids' teeth at some stage. A lot of parents are shocked at how, we did everything right, and, we breastfed and they still have decay. It's like, well, this is a generational issue, and we are probably going to be seeing this in your children's children as well, until we fix all of these factors that help the body to mineralize everything going on in the jaw.
Yeah, that is one issue that comes up. People talk about demineralizing and remineralizing teeth. I mean, is that something that you can actually physically see? I've seen people saying they went on, say, a vegan diet for a while, and their teeth got soft or demineralized, and then it remineralized when they started including, milk and eggs and dairy and stuff like that. Is that something that actually occurs?
Yes, so I mean, dentists are taught this in dental school, that the dentine has an ability to remineralize, and those odontoblasts we were talking about earlier inside the teeth are the directors of this. And so teeth have an ability, even when you get a cavity to a certain level, you can heal it over. It looks pretty yuck. It looks black because it's put reparative dentine down. But dentists get taught this. It happens. It's a capability of the teeth. Now, for certain lesions, you can't get dental enamel back, because you lose the cells that actually create dental enamel. So I haven't seen that happen, but you can regenerate the dentine. And look, it doesn't mean that you shouldn't be restoring teeth, because you don't want that. When you lose tooth structure, there's effects in the bite and so forth. But the general theme is you want to make sure that your body is starting off that remineralization issue before you do any restorative work, because everything's going to fail if the base is failing underneath. So that's the big message, is that yes, it can remineralize. Once it's gone too far, you're probably going to need restorative action. But in kids, for instance, if you get on top of it, teeth will probably turn itself around, and in adults too. So you see in small lesions, you can turn these things around. You don't have to have them filled if you're really strict with your diet.
Yeah, I was going to ask you about cavities coming back when you said small ones can come in. Kids with, the milk teeth, or the so-called baby teeth, whatever you want to call them. I see a lot of kids, when I was operating, I would see not infrequently kids getting their almost full mouth extractions due to, their parents put them to bed with Coca-Cola or something along those lines. Is there any long-term harm to that situation for the adult teeth that come in subsequently? Is it, can we just discount our baby teeth because we're going to get replacements? It seems like you shouldn't do that, but what are your thoughts on that?
Well, look, when you have issues with the baby teeth, the good thing is we get a rerun. So, for parents out there, they have a lot of kind of stress and anxiety around, kids' cavities, it truly is. But at the same time, we have to be a bit circumspect about it. We need to move on. Kids' teeth can cause infections in the gums, which can affect the development of the adult enamel, which we were talking about, but also to the development of the arch. So if you lose a tooth, you lose the space that the tooth holds, and the bite can change. So you can have effects of losing teeth early on the development of the jaw because the space in the dental arch is collapsed, and you can have, sometimes we need to remove kids' teeth, for instance, to help the movement of adult teeth out of the gums, but sometimes we need to try and maintain tooth as long as possible to hold the space. But the principles of that come from the tongue posture, and it comes from nasal breathing. So if we're generally telling the jaw to grow, then kids will correct itself.
Okay. Well, Dr. LIn, we've kept you for an hour. I'm sure you're about to start your day. I'm guessing it's probably morning time there, and you're getting ready to start a clinic, would be my guess. I don't want to get into your patient time, but is there anything else you want to share that we haven't covered? And then if not, can you let people know about your book, where they can find you, if they're in Australia and they want dental care, where they can go?
Yeah, sure. So my book's available, across the US, The Dental Diet, and we talk about all the mechanisms we discussed today, how nutrients, connect to, tooth decay, gum disease, and how we really, prevent this in our next generation, but also to how we stop these disease processes becoming worse issues later in life. Teeth are always the director of chronic disease, and we need to see them as being connected to the system that we all function in. And so, they can find more information at my website, Dr. Steven LIn, DrStevenLin.com, or on social media, Instagram, Facebook, and Twitter at Dr. Steven LIn.
Wonderful. Thank you, Dr. LIn, for doing this. I appreciate it. Keep up the good work. And thanks again for being here. Have a good day and make the best of it in Australia. Okay.
Hey, Shawn, you too. Appreciate it. It's great catching up.
Okay. Thanks, guys. See you guys tomorrow. Take care. Everybody.
Thank you.
Join Revero.health for a 30-day free trial to get access to live Q&A with VIP guests, social community meetings, member discounts, low-carb healthcare providers list, forum, workouts, monthly challenges, early access to podcasts, recipes, carnivore diet guide, fasting guide, shred guide, and much more.